Hey ladies. All right. So today we are featuring on how to just get what you need through the medical system. Sometimes TRICARE isn't cut and dry. We've got to go see a PCM. We have to, go through all the wickets and the steps on just to get what we truly need. If you are like me having to get surgery, you almost have to wait months as you go through treatments first or physical therapy. So we want to let you know that you can advocate for yourself. And to do that, we have a medical provider. Her name is Laurel Proulx. She's a pelvic floor physical therapist. But, we're not going to talk about just pelvic floor physical therapy. We're going to talk about all needs. And she has so much experience as she is a military spouse herself, as well as she has some medical conditions where she has had to, tell the doctors on who she needs to go see. And she's figured out that route for us today. So without further ado, welcome to the podcast, Laurel.
Hi, thanks for having me.
Of course. Well, I'm so glad you reached out to me. And, after we talked to Dr. Fisher about pelvic health, it's just such a needed entity. And it's kind of a difficult passage to travel in the military realm with TRICARE because you have to get approval. You have to have certain, you know, symptoms to get it. So you are here today to kind of tell us how to navigate that, what the benefits are, and how, as a military spouse, we can go ahead and do so. So, first off, let's start off with who you are and why this is such a passionate topic for you.
Yeah, thanks so much for having me. My name is Laurel Proulx. I'm a pelvic health physical therapist and currently in Kansas City, Missouri. Started in orthopedic care, thought I was just going to work with athletes and loved working with my triathletes, and then realized that after they got comfortable with me, they would start talking to me about at mile 10 I start leaking, or oh, will this also help with my pelvic pain if I was working on their hip, and started connecting the dots a little bit. And it took me down the path of pelvic health. And then I took a job as a researcher at Fort Sam Houston, Brooke Army Medical Center, and really was working in the chronic low back pain studies, and was realizing, if you hear sirens in the background, I'm so sorry. We're right downtown. Um, but then I started realizing we had a lot of the same questions about chronic pelvic pain that we have about low back pain. And as I dove deeper into it, as I was writing a grant and I was at Fort Sam, I realized how many of the active duty population, how much higher incidence chronic pelvic pain is in the active duty female population, and that the resources weren't really there, and then the path to resources wasn't really there. So I've gotten very passionate about, how do I get active duty or spouse of military who have this great healthcare, right? Like, it's free. I put that in quotes as if it's free, but then people don't know what resources are available to them or how to get those resources. And I'm still learning as a military spouse as well. So I'm a military spouse. My husband's in the Army. We just got back from Germany, and I have some autoimmune health issues that have kind of been mysteries. And I've gone down my own path in advocating for myself for certain specialists. And when we're in more remote places that it's harder to find those specialists, or you're in a different country, how do you do that? All that kind of stuff. So I love talking about this with other military folks, because it's a specific challenge to our system, where we have awesome care and it's paid for, but it's not the clearest route on how to get to that care.
Okay, so my plan for this episode just totally went out the door because now, with all your experience, and especially because you have your own experience on advocating for yourself, I would like to focus on that topic because, especially overseas, obviously you can tell by the background, I just moved to Korea,
Yeah.
and, they even mentioned hey, if we can't care for you, you go downtown and have to figure that out. So how do we
Mm-hmm.
advocate for ourselves no matter where we are in the military system with TRICARE?
Yeah, so let's first just break it down. And again, I am not a representative of TRICARE. This is from a consumer patient standpoint. This has been
It's
my
the honest
experience and then
truth.
what I've learned. Yes, yes. don't hold me accountable for your care, please. But I've worked hard to research it for myself. So most people, if you're living on base or close to base, or if you are active duty, you have Tricare Prime. So that is, 100% covered, no copays, no deductibles, but you meet with that primary care manager and they are your conduit to get to other specialists, right? So you can't really do anything without going to your primary care manager first. That person is assigned to you on base. And like you're in Korea, I was in Germany. We were on a tiny base. And so we had like a clinic. We didn't even have a hospital. But we still had that primary care manager there. And it was interesting to me because I assumed then that because they didn't have a lot of specialists right there, that then I would be able to find my providers elsewhere. But I was still under Prime. So still with Prime, no matter how few providers you have on that base, then they still need to refer you out to that specialist. So that may be easier for some specialties and not for others. Like it was great for pediatrics, asthma, GI, OB-GYN with people pregnant having babies. Like they had those referrals like lined up. They knew their community, everything was good. So most of the time you're going to get a referral that they have. Tricare has decided who they're contracting with, and Tricare will pay them that contracted rate. You see no bill. It's just like any other Prime option. But for someone that I needed, I have what's called mast cell activation disease, and it's like an overactivation of your allergy system. So I have anaphylactic responses to anything, right? So we were 45 minutes from the nearest ER. It was not a good situation. So I went about it. First, they sent me 4 hours to the next closest military allergist because that was their like contracted person that was closest. But what I know now is I should have gone directly to, and this is what you're going to do if you have this issue, is go directly to your patient liaison that's in your clinic. They're wonderful. They know all of your contracted folks. And if there's not someone close by, they will find someone. And if there's not a contract with them, then basically you get a bill from your provider and you take it into the Tricare office and they take care of it for you. So I was, after that 4-hour trip that was unnecessary, and I like had my piece of paper that said, I saw this person, great, cool. Then I found a great specialist just by searching online like I would for another doctor here in Kansas City, called them, made the appointment, asked if they took Tricare. They did not. Met with my patient liaison and they were like, go ahead, we have on file, what your issue is that you need the specialist. And then they took that bill from us. So it was a little more legwork, but I felt empowered that I was finding someone that I felt comfortable with that was going to be able to treat me well, instead of just be like, I'm going to who they told me to go to so I can check the box. Like we have to get these boxes checked for it to get paid for. Instead, it just like is a phone call, a conversation with someone. And when you're sick or when you're postpartum, that can be asking a lot of someone to have that sort of like self-advocacy. So having a partner or having a community that is kind of helping you out to say, it is worth a phone call, we'll figure this out, or like go to the appointment, I'll figure out the bill, I'll take it into the patient liaison on my lunch hour, I'm on base already. Those sorts of communications and being vulnerable, and as active duty females or military spouses, I feel like we're like, I've got it. Like, I'll take care of it. It's fine. I've got it. And when you're sick and you're needing help, a team-based approach with your partner is like necessary. So
No, that's
that's
good
kind of,
advice.
yeah, because you will take the easiest option, even if it's not the best option for you, because you're just exhausted, right? Like you just want it to be done. And instead advocating for yourself a little bit harder to get that right doctor, to get that appointment tomorrow instead of 2 weeks from now, to get like the different breast pump that isn't available in the pharmacy at the whatever, it's helpful when you have a partner that says like, I'll pick it up, I'll do the thing, I'll watch the kids, like you can't take care of yourself by yourself.
No,
So.
absolutely. And that's, talking about community lately and building that community no matter where you live. That helps as well if your spouse can't get off work or so on and so forth. Definitely
Definitely.
that military spouse network. So you
Mhm.
mentioned Prime. So is that the same for Select too? Is that
Right.
the same route?
So different. So select is, I'm not going to use the fancy insurance words, but select is basically a price per service option, meaning, so I was, previous civilian who had health insurance. And to me, select is like every other health insurance. So there's a certain amount that you're going to pay out of pocket. And I think I wrote it down here. So for in network, so if my doctor, my physical therapist, my whoever has a contract with Tricare Select, I'm on Tricare Select. In network for a primary care visit, it's $22. Out of network, it's $34.
That's the copay.
Um, that's the copay. That's what you're going to pay per visit for, like, I go in and get my yearly PAP and all that good stuff. $24. Cool. That's still really good insurance. Like, that's excellent insurance. So we chose to live further away from base actually this time, A, for like a real estate investment, and then B, for also to have my ability to be on Tricare Select to choose my doctors. It was important for me coming from a more rural environment where I didn't feel like my health was managed very well to take this year and really focus on getting some answers with the doctors that I could cherry pick. So I chose to be on Tricare Select. You don't go through a primary care manager. You choose your doctors. And for certain services, you legally need a referral, but you don't need a referral to pay for insurance. So what I mean by that is I don't need a referral to pick my OB-GYN. I don't need a referral to pick my dermatologist or my dentist. I can just pick online, give them a call. Hey, do you take Tricare? Yes, we do. Great, make an appointment. Tons of people take Tricare insurance. Fantastic. They know they're getting paid. They love Tricare. Then certain specialists like physical therapy, we have different laws governing what we can do without a referral based on the state that you live in. So in a bunch of states in the United States, you can go directly to a physical therapist. You don't need a referral from a doctor. You can walk in, you sprained your ankle playing kickball on Friday. You can go in on Monday with a sprained ankle and say, I need an appointment. I sprained my ankle. They're your people. Other states, you have to legally have a referral from a doctor to go to a physical therapist, and the same thing with a pelvic health physical therapist, because they're basically old laws. Before we had our doctorates, we were only following doctor's orders. Now we have our doctorates, we have evaluation skills in our schooling now to say, oh, this is actually fractured, you need to go get an x-ray, or, oh, you rolled your ankle, we can work with you on that. So in some states, you have to have that referral from your doctor before you go into physical therapy. That's not a Tricare thing, that's a legal thing. What I think a lot of people get caught up with, especially postpartum, because pelvic health physical therapy, you already talked to my good friend Amanda Fisher about it. It's not the norm to get that referral. It's not the norm to know to go yet. So we're still educating a lot of new parents, but also educating providers that you should be giving that referral out to everyone at 6 weeks at your 4 to 6 week checkup. But if they don't offer it, to ask for it. And most of the time they're like, oh yeah, no problem. If they don't offer it, or if you ask for it and they are like, what, why, you're not leaking, you don't have a prolapse, you don't, like all these things, just go straight to the physical therapist or call them, email them and say, I want to make an appointment with you. Would you mind calling my doctor to get a referral faxed over? It's the job of the physical therapist, like front desk, to keep referrals coming, to keep scripts in. They will do that work for you. They'll call them and say, we have Laurel coming in on Monday. Can you go ahead and send over a referral for this, this, and this? Here's our fax number. It's that easy.
And you
So
don't need to see a PCM or anything.
So you may have already be under the care of it. So maybe you had your baby, you had your 6 week checkup, all is good. You forgot to ask, or they didn't offer for the referral. Nothing has changed. You're not there's no new thing that the doctor needs to clear you of. They just saw you. So it is on a case-by-case basis. Like if I had a new pelvic health patient come in with like excruciating pelvic pain and they hadn't been to their OB-GYN in 3 years, then I would say you need to go get checked out by your physician first before I see you. This could be more than muscles, basically. But I would just always advocate to go straight to the provider that you want to go to and have them do the heavy lifting for you.
No, I think that is the best advice that I didn't even know of because one, a lot of medical facilities don't offer it because it's still kind of new,
Yep.
having a
Yep.
pelvic floor physical therapist. Um, and even Dr. Miller that we interviewed and Dr. Fisher both said that you couldn't come in while you're pregnant. So, I mean, if you are a person that wants to be seen by a pelvic floor physical therapist while you're pregnant to make sure your muscles are strong, because Kegels aren't that like, I don't know. I tried one video and it was like, pick up a blueberry out of a straw. And I was like, I don't understand what you're doing to me right now.
What are you talking about? Also, like, yeah, people don't realize that you don't have to hurt during pregnancy.
Mm-hmm.
And that gaslighting from physicians, family members saying like, oh, you're pregnant. Like, what do you expect? You're at the end of your pregnancy. And I've had friends who haven't been able to like put weight on their leg because of the sciatic pain. And I've told them, pain is not guaranteed to go away after the baby is born. Let's work on it now. Also, what's going to be better? You in no pain pushing this baby out, or you like can't get comfortable because of sciatic pain while you're also trying to birth? Like there's just so much. We can also work on birth prep, teach you how to push. Like that's a thing. We can teach you how to push your baby out.
That's so funny you said that. So in my birth story, I literally said that they're like, go ahead and push. I was like, how? Like, I don't know. I was in, rural Missouri where they didn't have any birth classes.
Yeah.
So that is awesome and that you can advocate. So like I was saying, since military doctors don't really know pelvic floor physical therapy yet, you really have to find your own anyways. So after,
You do.
so 7 months of trying, I didn't even find you, right? You were right in my local area, and they sent me, I think, 5 different places that were just physical therapy offices because they didn't understand. So I ended up having to find my own. So that's
Right.
awesome for all moms to know is go find your own, call them,
Mhm.
and then they can figure out that referral without you having to deal with your PCM.
Yes. Yes. That is their part of their job, to look into your insurance, see if it's covered, give your doctor a call, and get that referral. Also, things that pelvic health physical therapy is not, because then some doctors, especially like urogynecologists or OB-GYNs, that's really the only offices I've seen do this, will say, oh, we do that here. You can just come here. Well, what they have done is they've trained a nurse practitioner or a nurse tech or a nurse, anyone in their office who is going to be this person, and they'll give you a handout and they'll teach you how to do some pelvic floor contractions, or some people have invested in these really expensive like chairs that do e-stim on your pelvic floor as you sit in them, or they like hook you up to a machine that shows you if you're doing Kegels. So that's not pelvic floor physical therapy. So if you're like, oh yeah, I did that, it didn't work for me. Well, that's not really what we do. We do a full evaluation. You have a personalized plan. If all you got was a worksheet and hooked up to a machine, that's not physical therapy. Even though some people like to market it as that and then keep you in their office providing that for you. So know that. I also had the experience because I did a lot of prenatal postpartum education when I was in Germany with On Base, and then also the providers in clinic, because I was like, who are you all referring to? And they referred to a normal PT who basically just did all manual therapy, massage stuff around the outside of the pelvis. And so I said, so this is what we do, are trained in the United States. It's intervaginal. We do a full assessment. We're checking for prolapse, abdominal separation, pain, all that stuff. And they were like, oh. And I said, yeah, so you're not sending people to pelvic health PT. So the providers didn't even know who they were referring to. So I also coach women on to have them tell the doctor what to write on the referral. Say, I want the referral to say pelvic health PT for urinary incontinence, abdominal separation, pelvic organ prolapse, whatever. Take your little sheet in from like Google that you've looked up that you think you have, whatever it is, and have them write that down, because if they just put like postpartum physical therapy, that's such an unregulated thing that people are marketing, because they now see that birthing people are asking for more care. So it's a funny little referral marketing world out there.
I'll put that in the episode notes, like in quotes, because I think that's what,
Yes.
I did too. I was like, okay, it's like, what symptoms do you have? Why do you need to see one? I'm leaking when I jump. Like, I knew that was something. I was like, was I? No, but like, okay, well,
I need a
I just
reason.
need to get
Yeah.
in.
Right. Like, oh, I just pushed a baby out of my vagina. That's why I would like to go to physical therapy. Thank you so much. I just carried a human for 10 months. That's why.
No, so that's good. So what is the biggest difference that you saw from OCONUS to CONUS on advocating for yourself? Was it different or no? Should we expect the same thing?
So to be honest with you, I have not had Prime, so the one where it's covered and you go through a PCM, in the United States.
Yep. And most
So,
most spouses do not, unless you're
oh,
out of
so
that. So most spouses are on standard. Your active duty automatically get put on prime. So the
okay,
spouse
yeah. So
gets
I
to
mean
choose
standard,
prime or select.
yeah. So I have not had the PCM experience except for OCONUS. That was the first time I had to go through a PCM and choose my provider.
Okay.
And then get referred without choosing my provider, I should say. So I am much more comfortable in the select world, because I think I am a provider. And so I know what I'm looking for, kind of who I want to be in charge of my care. It has been tricky though. Like, I've had a few emergency room visits here and not feeling confident, like, oh no, like what if figuring out the ER in the city that takes Tricare,
Mm-hmm.
you know? So that's something to think about, is if you're further away from base, like just go ahead and figure that stuff out, like before you need it, right? What emergency room, what urgent care, that sort of thing, takes Tricare. Just have that on the refrigerator. But I liked my PCM in Germany. I did feel like I had to validate or defend a lot of the times why I was asking for a referral, which in my book was strange. Like, from being a care provider, if someone's asking for something, they've already gotten to the point that they've needed it for a while. People don't ask for things until they're really in need. And sometimes it takes a lot for people to ask, because they're going to try to like push it under the rug as long as they can. So I thought it was strange that I constantly had to like defend or show that I had different symptoms. And I'm like, are you paying for this? Why am I having to defend this? Like, is this coming out of your paycheck? I don't understand. But then ultimately I was able to get what I needed, and it was still paid for. It just did take a little bit more legwork. And I've done a few kind of lessons on self-advocacy when you're asking for a referral and for some reason you have a resistant physician, is, kind of give like, I want to go to this person, here's why, and here's like the history of my symptoms, so that people know how long you've been dealing with something, or that you've tried something else, or like give kind of the history of your symptoms. Also, talking the talk helps. So I always give the example of like, if you go into a doctor and you're like, I need to go to a hormonal specialist because I have adrenal fatigue. Physicians don't learn the word adrenal fatigue in medical school. That's a wellness term. That's something that we've all learned through like functional medicine doctors who now have Instagram accounts. Instead, you need to, it's called like the something pituitary adrenal axis dysfunction. That's the word. If I went into a doctor and said I had the HPA axis dysfunction, they'd be like, oh, interesting. We need to get your labs done. So it's hard and it's not fair. But it's also just part of the culture of medicine that you have 10 to 15 minutes with the individual. So your communication has to be like on point to get your point across.
No, and that's valid, because we all think they read our records beforehand, but they ask the same questions every time. So I definitely think one thing to add would be, we have to keep records of our own medical history.
Yeah,
So we can
that's
do
such
that.
a
Like,
good point.
hey, starting this date, because they're going to ask, hey, when did this start? I don't know, a while
Mhm.
ago. So having that kind of self record of yourself on when your symptoms started and what you experienced and the pain factor, like just having that, I think would get you be able to advocate for yourself more and get what you need faster.
That's such a good point. And I think that military folks are also unique in the fact that we're moving so much. And so we have like our stuff and like, this is my medical binder. This is my moving binder, like these are the receipts for everything. Um, I like to have a one page, this is more for like chronic issue folks, like you've been dealing with something for a long time. You've had to hop from doctor to doctor. And so it's exhausting to tell your story again, right? To start over from the beginning, tell your story. So having a one page, like, here are my top symptoms. Here's the timeline, like when it started, when things changed, blah, blah, blah. On one side of the timeline, on the other side of the timeline, I do, this is where I was living, or that I was in grad school. My husband was deployed, all these things. Some people, physicians don't care about that. I love that as a provider because lifestyle changes tell me a lot about what's affecting these changes. And it also is helpful as a practice to the person to put these pieces together. That, oh my gosh, when I got worse was actually when I moved into that new house and my husband was deployed and, I was sleeping 4 hours a night. Weird. Stress had something to do with that. And I wasn't putting that together. Or that house was moldy and I had no idea until we moved, like those sorts of things. And then I always have people write down, this doesn't need to be on anything that you give to the doctor, but in the notes section of your phone or something, before you walk in, what are the top 3 things that you want to get out of that appointment? So are you looking for a test to be ran? Are you looking for a prescription? Are you looking for a referral? Are you just there to hear that you're good to go? What are you wanting to get out of that appointment? Because then you are driving the result of that appointment instead of going in and saying, I'm here, this is what's happening. I don't know. I don't know what to do.
Sounds like my
And
appointments. Just fix me.
that's, yeah. Which, it is a provider's job to be connecting those dots for you, but it's so helpful to know what end game they're looking for at the end of that appointment. Because unfortunately, physicians, nurse practitioners, primary care providers have 10 to 15 minutes because that's what they're getting paid for from insurance reimbursement. It's not their choice. They're also burned out. They would love to spend more time with you, but unless you're going to pay for $120 for 45 minutes of their time, that's what they're getting reimbursed for. So
Interesting.
not a great system. And both sides of the aisle, the PT or not the PTs, the physicians, the care providers, and the patients are not winning. Like, it's not good for either party. So know that we should be working together to find the solution instead of just being angry. The other side.
No, I really appreciate you've got quite a bit of nuggets that I will absolutely include in the episode notes. But I think one that you don't even recognize that you said was having on your refrigerator already planned out even before you need it is an emergency number that takes Tricare.
Yes.
I think that is amazing.
Yeah.
And then having, what you want. So you're driving the appointment ready and planned out. And plus they always ask you at the end, like, hey, what other questions do you have? And you always forget. So having those ready is amazing. And then being able to advocate for yourself that you don't have to rely on the medical system. You can choose it. You can go in there and then just, again, be that liaison, your own liaison, unfortunately, with the TRICARE office.
Yeah.
I think that is
And
amazing.
also know that, like, if you want to give TRICARE Select a shot for a year because you're like, maybe I want to choose my own providers. I've been dealing with this provider, hasn't gotten me what I wanted, or my PCM isn't referring me or whatever. And some people love that system and it's not an issue. If you want to try TRICARE Select for a year, then you can always re-enroll every November, right? So you're not married into a system forever. You're not making your decision for the rest of your life. Maybe it's just one duty station that you look around and see the situation. We have the opportunity to change our minds a little bit more than someone that moves to a new job and you're enrolling in healthcare. You get kind of one shot to choose your plan. And then that's, you can change it the next November, but you're not moving to a new city with new doctors. So there are more options for us. And don't be afraid to make the wrong decision because it's a year. and then you can change your mind.
Yeah. So, and what she's talking about is actually, we're in it right now as we record on December 5th. It's open enrollment season for TRICARE. So it starts November to December every year. Or if you PCS, have a baby, basically they call them major life events, you can change
Yes.
your, from standard to prime. So if you want to try it, active duty, unfortunately, you go automatically to prime unless I believe you're like 45 miles away from the nearest installation. Duty station. Then you
Military
can go
healthcare
ahead.
facility.
Yeah, so then you can go ahead and get select, and then spouses, of course, you can change as well. So there's some information on that. We are in it right now as you're listening, so if you are interested, it is intriguing. We had Trip on select for while we were in Missouri for a year and loved it that we could choose his own doctor and not have to be seen on base, especially with everything COVID going on, and them not being able to do everything that off-base could. So it is interesting, especially right now in these times.
Yes. I bringing that up, I know you're trying to wrap up and keep telehealth services. Military healthcare facilities are doing a great job with telehealth services. Also know that, calling in to folks and asking what their telehealth services are, this opens up a lot of doors for us for like physical therapy, mental health, things like that, that providers that you may not normally be in your city, if they're in your state now and they hold a state license where you are, then you have access to them. So I have some friends seen some great counselors and therapists on the other end of Kansas they would never go to, but now that they're doing telehealth, they're covered by TRICARE and they can see this awesome therapist over telehealth. So it also opens up some doors for us.
That's awesome. I did not even think about that. You can go to the big name people.
Yeah, exactly. As long as you're in the state where they have a license, then it's fair game.
Awesome. So. Well, Laurel, I really, just appreciate your expertise in this. I don't think we honestly realize that we can advocate for ourselves and that we can drive our health needs in the military because we're so used to being told what to do. So thank you so much for everything. And we just appreciate you being on today.
Thank you so much for having me. This was great. Yeah.
All right. There was so many nuggets in that. Guys, oh my goodness. Like I said, having just a sheet on your refrigerator of what emergency centers or urgent care centers take TRICARE is immaculate. Never even dawned on me to do that. So we're going to include all her tips, advice, how to advocate for yourself in the podcast notes. But share this episode. I think everyone, no matter if you are a mom or not, needs to hear this. So your episode notes and the podcast and YouTube can be found at themilitaryworkingmom.com/episode 042.